Now we will going to discuss parietal bone, os parietal. We have two pair bone in our skull. Okay, this is two parietal bone. Here is a connection with the frontal bone, making a coronal suture. Here between two parietal bone we have sagittal suture, and between occipital bone and parietal bone we have lumboid suture. But our topic is parietal bone, then we will discuss the parietal bone. Parietal bone we have four angle, angulus, citiri angulus, four angles and four borders, or four margo, four borders and four angles in parietal bone. Now how we will now where the angle and where the borders. Okay, now we will discuss first the angle. Four angles are angulus of the parietal bone. First one, here is which bone we have? Here we have parietal bone and we have temporal bone and temporal bone. Which part we have? Mastoid process. And if we have connection with temporal bones, mastoid process, then we call this is the mastoid angle. Mastoid angle. And angulus mastoidus in Latin language. Here connection with the which, there is sphenoid bones. Here we have sphenoid bone, temporal surface in greater wing. There is a temporal sphenoid connection with sphenoid bone. That is called as sphenoid angle. Sphenoid angle, angulus sphenoidus. Okay. Now we discussed two angles here. Take connection with the occipital bone. This is occipital angle. Occipital angle. And here connection with frontal bone is called frontal angle. Frontal angle. Okay, four angles which we discuss. First, connection with the temporal bone process, mastoid process is called mastoid angle. Connection with the sphenoid bone is called sphenoid angle. Connection with the occipital bone is called occipital angle, and connection with the frontal bone it's called frontal angle. This is the four angle, 1, 2, 3 and 4 angles in parietal bone. Okay, now we're going to discuss the borders. Which borders we have in parietal bone? No borders. Now here I told here is we have temporal bones laterally. If we connection and which part of temporal bones? Squamous part of temporal bones. We have laterally connection of this parietal bones, and this is called we have squamous border. Squamous border or margo squama. Squamous border. Here is connection with occipital bone. Very simple. Occipital border. Here connection with the other parietal bone. Between two parietal bone connection we have sagittal suture. It's called sagittal border or margus sagittalis. And here connection with frontal bone is called frontal borders. These are frontal border. Four border and four angles. Occipital border connection with the occipital bone, squamous border connection with the squamous part of the temporal bone, frontal border or frontal because here is also squamous part of frontal bone. This is the frontal border because connection with frontal bone, and sagittal border connection with the between two parietal bone. This is the borders. Okay. In parietal bone, os parietalis. And here we have this is parietal foramina, very formation, parietal foramina, and here we have parietal suture, parietal tubers or eminence or parietal tuber, and here and laterally we have two lines. Okay, one is superior temporal lines, and this is the inferior temporal lines. Inferior temporal line, and here superior temporal line. Okay, laterally. This is formation which we discuss. In parietal bone, first formation we have parietal foramina, we have parietal tuber or eminence, and here we have, so laterally we have superior temporal lines and inferior temporal lines in parietal bones. Very simple for angle, for border, and 5 formation. Okay,